Hey guys, welcome to this chapter. I'm Dr. Haider Ali, pulmonologist and airway disease specialist. So today we're going to talk about very specifically about a disease that affects many people in the US and around the world, and it's called COPD. There's a good chance that many of you have heard of this, and it stands for chronic obstructive pulmonary disease. But I'm going to try and unwrap a few enigmas about the disease. We're going to talk a little bit about really the ways you can help yourself if you have this disease. And I'm going to outline a few different ways that you can really make yourself a better person to really minimize the effects of this disease on you. Okay, so let's jump into it. We're going to split it up into a few sections and then we'll break it down piece by piece. Okay, so section number one, what is COPD? So COPD is a chronic irreversible pulmonary disease which usually manifests anywhere from your third decade to anywhere from your 30s, but mostly it's diagnosed in your 50s and 60s. It's like I said, a chronic disease where people struggle to breathe, and really, if you look at what's going on a biological level, is your lungs have sustained damage to the point where they can't get all the air out of their lungs. Okay, so there's two real big parts of the disease. One is chronic bronchitis, which means that your airways are in a chronically inflamed state. They produce a lot of mucus, and so people may notice that they're just coughing up a lot of phlegm all the time. The other piece of COPD is a condition called emphysema, and that's where the sort of air sacs in the lungs where you take up oxygen, they've been damaged and they've become they cause your lungs to hold on to a lot of air. And so most people with COPD have a combination of both of these processes going on in their lungs. So the way I try and explain to people what it must be like to have COPD is if you all take a deep breath in like this, and imagine trying to do everything in your day whilst holding your breath. Like you've got to walk upstairs, you've got to walk up inclines, you've got to, do housework, all these things, but you've got to do it with your breath held in. Now you can still breathe on top of that held breath, but you'll instantly realize how difficult that is. And that's what it's like having COPD. So a lot of you out there watching this who have COPD, you'll really hopefully identify with this, that there are days where you just really feel like you're not up to doing very much. Okay, so let's break it down in the next few sections and let's talk about ways that we can really get you feeling better with this condition. Okay, so because I'm a physician, I'm going to talk about medicines and inhalers first, because these are really the mainstay of what we prescribe, as traditional doctors. So inhalers are a way for us to deliver drugs directly to your lungs. Now, the categories of drugs we use in inhalers fall under two broad categories. There's bronchodilators, which means things which open up the lungs or open up the airways. And there are steroids, inhaled steroids, which help reduce the inflammation in the airways as well. And so we use one or a combination of or both of these, which to help try and manage the symptoms with the disease. What I will say is inhalers, especially depending on where you live, can be very expensive. They don't prolong your life by any means, and we really only prescribe them to help people's symptoms. We know inhalers are pretty good at reducing flare-ups of disease, so we do find that if people are having a lot of infections, airway infections, an inhaler can help curb that. Now, there are also, the other way we can split up inhalers is there are relievers and controllers. Now, relievers are very quick-acting inhalers like an albuterol or salbuterol, depending on where you live. And these basically will, when you do take one or two puffs of a reliever inhaler, they will get to work immediately. They will open up the airways within 10, 15 minutes, and the effects of that inhaler will last in your body probably around 2 to 3 hours. Now, controllers are medications that are inhalers that you would take every day, regardless whether you feel well, whether you feel ill. These are really the foundation on which your lungs are going to build. And these inhalers are usually long-acting because you may take them once or twice a day. So the effects of these inhalers will last anywhere from 12 to 24 hours. And again, these can comprise of bronchodilators, things which open up the airways, or steroids, things which reduce inflammation in the lungs. Now, apart from inhalers, we also use steroids, tablet steroids. Many of you may have had courses of steroids during a bronchitis or an episode of a flare-up or other types of infections. Now, we try and minimize steroid use because we know they have side effects. We know they can make people feel quite funny when they're on them. But sometimes they are needed in short courses, anywhere from 5 days up to 2 weeks, and they can really help reduce that overwhelming inflammation in the airways to really get you feeling better as well. Now, obviously, steroids can only be prescribed by a physician, so make sure you want to see a physician if you ever think you're getting to that point where you need something extra to help what's going on. Now, with all of these medicines, it's really important to have a physician involved. You need someone who's monitoring how you're using these inhalers, the frequency at which you're using them. You also want a physician or a provider to check your inhaler technique at least once a year, because a lot of these inhalers, they come in different forms. There's dry powder inhalers, there's aerosol inhalers, and some of them can be quite tricky to use. So really do get with your physician and get them to look at how you're using these things. So the next section we're going to talk about is flare-ups, or COPD exacerbations, as we call them in the medical world. What this is where you'll notice over a few days, you'll notice your symptoms are just getting a lot worse. Now, I tell all my patients with COPD, look, life is not going to be perfect. You're going to have good days and you're going to have bad days, unfortunately. But we want to make sure that those good days far outnumber the bad days, okay? It's okay to have a bad day now and then where, for whatever reason, you may not be feeling 100%. What we want to know about as your doctors is when you start getting a few of those bad days in a row. So if you're getting 3, 4, 5 days in a row where you just can't kick whatever's going on, your breathing is worse, you're coughing up more sputum or phlegm, the phlegm is darker, it's changed color, you're wheezing more, you may be having some fevers, things like this. If you're just not feeling right, you really do need to get in touch with your physician, because you could be having an exacerbation. And why it's important to know this is because if you are having an exacerbation and it's not adequately treated, you could end up with you being in hospital. We don't want that. So really get in touch with your physician, see if any other treatments are required. You may need extra tests like a chest x-ray to do. Don't ignore it. Try and get in touch early, because the sooner we can intervene, the better the outcome will be. So how do we prevent flare-ups? That's really the name of the game. We really want to stop you from getting these episodes of acute bronchitis. And the reason for that is every time you get bronchitis, your lung function may have taken a little hit. And we really want to try and preserve your lung function as long as possible. So really cutting down on exacerbations is a really big deal for us. Now, we do this with various kind of methods, okay? So the one we've already talked about is using your inhalers. If we use your inhalers appropriately, we know it can definitely cut down on the number of flare-ups you get. Other things you can do is getting your vaccines, right? So getting your flu shot every year, your RSV shot if you're eligible, and your pneumonia shots. So those are really important. So speak to your physician about what vaccinations may be appropriate for you. And then there's a lot of other sensible, common sense things like, always wash your hands, try and avoid being around other sick people or in sort of large crowds in confined spaces where there'll be a lot of airborne viruses potentially going around as well. So just be mindful, if that relative is coming over but they're sick, or that grandkid is coming over, you may want to say, you know what, let's just wait until everyone's healthy and then we'll get together, because the smallest virus for a kid or a healthy adult can mean something far more serious for someone like yourself with COPD. Okay, so the next section is about breathing techniques and airway clearance. Now, we use the term airway clearance to describe the process of removing mucus from the lungs. Now, depending on what kind of COPD you have, some people have a type of COPD where they produce a lot of phlegm on a daily basis. And for those people, airway clearance is critically important. There may be others of you who don't really have a cough or don't produce phlegm, you just feel a bit breathless, and that's okay too. But we want to make sure that people who do have a lot of mucus are able to expel that mucus properly. Now, when you breathe in, 90% of the work is done by your diaphragm, which is a big band-like muscle which sits above your liver, kind of just at the bottom of the breastbone. So when you breathe in, that muscle contracts, it moves down, and it pulls air into your lungs. So we know that breathing using your stomach, because when you sort of breathe in by pushing your stomach out, that really is where you're using your diaphragm, and that's the most efficient way to breathe. Another thing that can help some people who have a lot of breathlessness is pursed-lipped breathing. And what that is where when you exhale, when you breathe out, you do it through pursed lips like this. So you breathe in and go. So when you breathe out like that through like a very small orifice in your mouth, what it's doing is it's helping keep those airways open. In COPD, what can happen is your airways can sort of collapse down very early, and that can make you retain a lot of air before all the air is expelled from your lungs. By doing pursed-lipped breathing, it can really help empty all those lungs before those airways collapse. I've had a couple of my patients who carry a straw with them, and when they're feeling more breathless, they'll take slow, steady breaths through a straw. They'll breathe in normally and then breathe out through a straw, and that will again help that overinflation of the lungs and help your air get out. So that's important as well. The other thing to mention is with airway secretions, for those of you who do produce a lot of phlegm, you can often tell if you have secretions stuck in your lungs and your airways by doing something called a huff cough. Now, a huff cough is where you take a really big, deep breath in, and then you're going to blow out suddenly as if you're blowing out candles on a birthday cake. But the difference is you're going to do it through a wide open mouth. So instead of going like this, you're going to go like this. And what that does is it helps move any secretions up from the small airways to the larger airways to a point where you can then cough them up. So huff coughing is a very important part of airway clearance. There are other more nuanced ways to remove mucus from the lungs, but we'll tackle those in another video. All right, the next section is about staying active and really staying strong. So physical activity is hugely important in COPD. We know that studies done a few years ago have shown that people with COPD do lose a lot of muscle mass, and it's actually more muscle mass than you would expect just from not maybe moving as much. So there's something about the disease itself which puts you into a state of metabolism where your muscle fibers get broken down. So the way we prevent that is we really encourage all of you to stay as active as you can. You really want to try and register a certain number of steps every day. We really want to see you, try and do some resistance training, maybe with some resistance bands. Another big one is engage in pulmonary rehabilitation, which is a program that's really designed for people with COPD. So if that's something that you haven't heard of, or you have but you weren't aware what it is, please ask your doctor about it. There's hopefully a program near you, and it has tremendous benefits in helping you breathe better and just manage your disease on a day-to-day much better. So do ask about that. The way I sort of describe pulmonary rehab or just exercise in general to someone with COPD is, if I was going to go and run a marathon, I wouldn't just go and do it tomorrow. I would have to train over months and months, get my running distance up, really train and condition my body to be able to run that kind of distance. And it's a little bit similar with COPD. With COPD, we know your lungs are not perfect, right? So what can we do to compensate for those lungs? Because they're not going to get better. But what we can do is we can train your body to become more efficient. So the body doesn't need perfect lungs anymore, because the muscles and your heart have become so efficient that they can deal with less than perfect lungs. And that's what exercise and pulmonary rehabilitation is doing, is it's really conditioning your body so it adapts to a different environment where your lungs are not firing on all cylinders. And so that's a really important part of why people's symptoms can improve with exercise in COPD. So give it a try. Really do try and engage in pulmonary rehab, speak to your physician about it. It's hugely, hugely important. So the final section is going to be, we're going to talk about mental health and emotional well-being. This is a huge topic in COPD, and it's very, very important because we know there's much higher levels of anxiety and depression with COPD. You may have been someone who was very active, and maybe your activity has changed over the years as your disease has manifested itself. You may also feel very isolated. It must be hard, right? You've got this disease, you don't know anyone else who has it, and other people don't quite know how you're feeling, especially if you're having one of those really bad days and you're just not up to doing something that your friends want to do. So a couple of things. I think it's important to share your diagnoses with your friends and really let them know, let your friends and family know what this disease means to you and how it affects you. That's really important. You've got to bring other people into your inner circle. The other important thing is you've got to have ways that you can help yourself de-stress and center yourself when you are feeling unwell or you just feel a bit down. That may be breathing exercises, it may be mindfulness meditation, it may be listening to music, or if you're spiritual, it may, may take being in prayer to do something like that. So there's lots of ways you can do that, and you'll find something that's very, that works well for you. But if you are having fairly persistent and severe symptoms of being down and feeling anxious, it's really important to let your physician know, because don't suffer in silence. There's a lot of things that can help, such as therapy, counseling, even medications occasionally can be used to really good effect. So that's a really important part of managing the disease, is managing your mind. And just another plug for pulmonary rehabilitation. Again, that's another reason why we encourage people to get into pulmonary rehabilitation. It takes away, or it lessens that isolation, because you will meet other people who have the disease, other people who have found solutions to problems maybe you're having. And so you can compare notes. You'll realize that actually, you know what, there's a lot of people in my position and they're doing X, Y, and Z, and it's really working well for them. So that's, again, a really good reason. The final thing you can do is join a support group. So the COPD Foundation has support groups that you can get in touch with. There's Facebook groups as well. Again, really good resource for you to be able to just ask other people like how they manage a certain symptom. A lot of my patients have found it really helpful to inquire about different inhalers and medications from other people. So it can be a huge resource if you use it wisely. All right, guys, we'll wrap it up there. I just hope this video was really helpful for you guys. So, just to recap, there's a few things you can do for COPD. It can be a tough disease, but there's a lot you can do to help yourself. I think the first thing is just making sure you're taking your inhalers and your medications as prescribed, making sure you're engaging in all your preventative care like vaccines, stay active, really try and exercise. If you need supervision to do that, ask about pulmonary rehabilitation, really manage and be aware of your mental and emotional health. It's a huge part of it. And really learn to recognize when you're getting an acute flare-up or an exacerbation and get help early, because we don't want you fighting this on your own. I hope this was useful. We'll see you next time. We'll talk about another topic, but if you have any questions, hopefully we can answer them in this video and others. Thank you. Take care.